Today I'm joined by Dr. Sue Cheng, a board-certified radiation oncologist with Morris Hospital and Healthcare Centers, as Dr. Cheng practices at the Radiation Therapy Center of Morris Hospital at 1600 Route 6 in Morris. And we want to spend some time talking about skin cancer because May is Skin Cancer Awareness Month.
Absolutely, and the sun is out. We're all loving to get into our gardens and even plant our farms, and so we're all going to get a lot of sun.
Exactly, and if you could give us some skin cancer statistics, how prevalent is it?
You know, we think a lot of places just kind of burn them off, so the statistics are probably low, but the last count was 3.3 million cases in 2012, with most of those, like 80% of those, the basal cell carcinoma, which have kind of a pearly nodular look, versus the squamous cells, which are much more dangerous and can spread, with 200,000 cases of melanoma expected this year. And that is fairly deadly, and if it's too deeply invasive, requires chemotherapy.
Let me ask this. Do you think perhaps some folks take the potential of skin cancer too lightly?
Absolutely. I just can't resist bringing up the fact that I found out that 1 million people use tanning beds every day. And more than a third of adults, 60% of college students, and more than 17% of teens have used a tanning bed. We account for as much as 400,000 cases of skin cancer each year due to tanning beds, and we only get 200,000 lung cancers. So 200,000 extra cancers may be coming from tanning beds.
Wow.
And it's still the same UV light that comes from the sun. So you want to prevent this. You don't want to have to find out you have it and then have somebody have to remove it surgically with a graft patch from another piece of skin, or even the radiation that we give, which can be 20 to 33 treatments coming and going Monday through Friday. We'd rather not have to treat you.
Sure. Well, and as we've learned, though, too, prevention, not just with skin cancer, but with a lot of different cancers and ailments, prevention is a real key.
And even if you don't mind having sagging and peeling and blotchiness and wrinkles, you know, you just probably don't want to risk not just squamous and basal cell carcinomas, but again, the melanomas, which are happening in younger and younger people. And there is a significant mortality rate from that. So it's much more serious than your basic skin cancers.
Are there screenings for skin cancer?
Yes, actually, we're about to get back into our annual free cancer screening, which would involve doctors and nurses looking at your skin for free. But anytime you have something on your skin that doesn't look right, it's feeling bad, it's itching, or it's getting larger. The big one is if there's purple and black and brown changes to it, or it breaks down. Anything that bothers you, you should get in to see your doctor and have them look at it.
Are there other warning signs?
Well, definitely. Even some of the age spots that you think are just from aging can turn into cancers, and we know which ones those are.
Gotcha.
So even if the doctor removes it, if they remove a precancerous lesion, then you're preventing the cancer.
All right. Very good. Now, you did want to make mention of, using sunscreen?
Oh, yeah. So, by the way, there's a little point that our damage to our skin comes from UV light, and 95% of our UV is A and 5% are B, but most sunblocks will not block the B unless you get a broad spectrum. And there's two kinds. There's that creamy white one that's usually labeled zinc or titanium oxide versus the clearer kind that you can spray on. Those are more chemically, but they actually don't irritate you much. And no matter what you use, you should wear it for 20 to 30 minutes before you go out. It's not that it doesn't stick to you, but it's that it needs to kind of dry out and spread so that you have a more even coverage from wherever you put it.
Okay.
The UV light comes through glass. So if you're inside your car or your house, you can get exposure even through glass. So consider putting your sunblock on then, too.
Sure. What are some treatment options?
Well, we hope that you don't need it, but generally, dermatologists have very sophisticated ways of removing them, either with a knife or using the shave form of removal called Mohs surgery, and we do have Mohs surgeons in and around Morris that just remove little slices of the cancer until they don't see anymore. But all these things could cause scarring if the nodule or the area is large enough. If we give radiation, most people don't have any permanent scarring from the treatment. They look fairly normal when we're done. So radiation is an alternative to surgery.
All right. Well, tell us about the Radiation Therapy Center at Morris Hospital.
Well, we just have we're open every day, Monday through Friday, and patients come in for what ends up being about a 1-minute treatment where we use custom blocks that just limit the radiation to the area we need to treat. And the smaller, the better. But the treatments really only take about a minute, so you just come and go, and our staff is always ready to answer any questions you have.
Dr. Suzan Cheng with Morris Hospital and Healthcare Centers. My guest on this Friday Business Spotlight is Morris Hospital. It's accredited by the Commission on Cancer of the American College of Surgeons as a community cancer program. Dr. Cheng and the staff at the Radiation Therapy Center guide patients through cancer care treatment with warmth and understanding. Morris Hospital ensures access to comprehensive care, state-of-the-art services and equipment, and a multi-specialty team approach. To learn more about the Radiation Therapy Center of Morris Hospital, please phone 815-364-8915.